MRI 로 골랐어.
Day 26 na giman de chance pabu kaisa na hospital jaye.
Ekuna hoto next month or ekuna ho.
It's just the pain, no?
Even as a retired government doctor and having served as former managing director of Naga Hospital Authority Kohima and as former mission director, National Health Mission Nagaland, both under the Department of Health and Family Welfare, Government of Nagaland, Dr. Thorsie Katiry remains dedicated to serving the community at Teja Clinic in Kohima. He shares valuable insights on several lifestyle diseases and other prevalent health concerns.
First of all, I want to give myself an introduction a little bit in brief. Dr. Thorsie Katiry. I retired from my active government service in the year 2022, in December. Since then, I've been running this a little bit of, not always, but whenever I get time, I do give sort of philanthropic service also, conducting health camps in some remote areas, just and health talks, especially now in the present days, lifestyle diseases are becoming very common. I was brought up in a Sainik school from West Bengal, Sainik school Purulia. Had it been to speak the truth, I would have not come out up to this stage. But I was fortunate enough to study in the Sainik school, and the activity, the routine, that which they maintain discipline, and then I think trustworthy. I think discipline is one of the cornerstone of my status. I came up to this stage because we were given all sort of activities which have got a very tremendous impact even you become old at this age also. That you have a contact, you can meet friends, and you don't have any to get panic, you don't have to get any psychological deficiency. Outwardly, inwardly also, you become that you want to do something. I joined in Sainik school in the year 1973. Then I passed out 1980. Then 81 I joined MBBS, and then I studied for 4.5 years. After completing again, I came back again, cleared my NPSC, and then I was in the service for a short period of time. I was posted in PEC, and then Meluri, and then Akego. Then from there we have got a state quota in RIMS, Regional Institute of Medical Science in Impal. I got as a postgraduate, fortunate to get it a postgraduate, MT in medicine. My motivation started from the school where I study, and then initially in the first year, if you fail, it's okay. But in subsequent year, if you fail, you have to return back with your bag and package to village. So that was my scary thing, that I was forced to study and compete with the best of the best student. And activity and all this also, I try my level best as God has given me physically active. I really compete, and then we have got various of activity all in Sainik school, sports weeks, then tournament and all these things. So this having a physical activity, of course there we don't have a church and all that in our school, but I think your upbringing in the childhood is very important, and this is what I feel that I'm lucky to be here today and able to help some of the patients who are needed most. I was on study leave for 3 years, MT course, and after I came back again, I joined the service. It was really full of joy and happiness. Staying in remote places, what I find inaccessible area, because I'm basically a physician. But you have to deal with all surgical cases, all the gynecological cases, even pediatrics, and even geriatric old age patient. So you learn somehow as a landing in health and family welfare. One of the advantages is that when you are posted outside, you will come. You have to deal with multidisciplinary pediatrics, children's disease, even gynae problems, deliveries, and even injuries, fractures, orthopedics, surgery, all this. You learn again the skill. And I should say that our Nagas are very good in picking up again. They can operate even though they may not be super specialists or specialists, but they're good, equally good. The way they handle the serious patient, I think we are second to none. I really thanks Almighty God that He has given me a life which I don't deserve also, if I think sometime. As a sinner, but He has given me to practice again after my retirement of service, and I'm able to see patients. As a physician, what I find is that in the present trend of what I've seen, a few of my patients, common one is that I think these lifestyle diseases. As we know that we have our way of living has changed drastically, not like in the past days. Now people have been more adopted to sedentary lifestyle, and eating habits also they have changed. And I should say that this is diabetes, hypertension, diabetes, obesity. These are few common people's diseases. We have adopted a lifestyle which is totally sedentary. Unlike those days, our forefathers, they used to work very hard. They eat a lot, but they also would work a lot. They sweat a lot. They work a lot. But now we go quite non-communicable diseases are very common, like hypertension, diabetes, stroke, and all these things. It's because of we don't move. We just get up on the car, you go to your office, come back your corridor, car park, and you start taking rest. So I want to advise is that especially eating part, meats, especially meats, I think we should have minimize. I'm not telling that you totally stop again. It's very difficult for our Nagas. Some of my patients, they say that they want to keep even I don't take meat, I want to give it a decorative by the side of the plate so that I can have a good appetite. So we have so much fun over this meat, but now eating so much meats, it doesn't help much. Rather, you should eat more vegetables and more exercise. This will give a quality of life, and also it will give you the way that if you don't want medication, if you don't want to go to doctor, one need to control, especially eating part. I should advise that overeating is a taboo. There are two types again. One is insulin-dependent diabetes mellitus. That is as soon as the child is born, they are born with diabetes. As mother is diabetes. Not always, but some percentage. Another one is non-insulin diabetes mellitus. It can be started from the age of any, say starting from 30, 40 onward. And also this is because of related to our lifestyle, because of eating habits, and also lack of exercise. If you suspect the sign symptom of diabetes, we ask them to go into at least urine examination, then blood sugar, and we don't just straight away write the medicine in the first visit, but initial investigations has to be done properly, and we ask them to check every 3 months. Once the patient is diagnosed again, and then there are few patients again, they're reluctant to start straight away medicine because they say that once we ask them to take blood pressure medicine or diabetes medicine, these are the medicine which is very important throughout your life. But the thing that it is some periodical only they take and then it will get cured. It is not that so. So what my just humble request and advice is that yes, no doubt these are lifestyle diseases, but one has to take care of his health and one has to also monitor by blood examination or X-ray and some basic investigation, blood pressure checkup. These are mandatory. You have to keep on checking up. Even if you can check up at home, these days there are few, if you don't come to doctor, as a physician also you can do investigation at home monitoring without a mercury one, digital one. Also coming across again, hypertension is very common because people have less care about their health. As we know that prevention is better than cure, but most of us, we don't take it very seriously, as if health is just automatically it will come itself. But health is not like that. Health, one have to be really conscious. Your sleeping time, your eating time, your movement, body exercise, these are very important, to have a healthy and free of diseases. I also come back to obesity, also quite common among the young college goers and high school students. Obesity also increasing again in the society these days. Diabetes, hypertension, and we do come across quite a good number of stone in the gallbladder, stone in the kidney. These are really a very serious problem. If one don't take it immediate measure, then it can even cause a life also, especially with gallbladder stones and appendix. These are also serious ones. They ignore it, and then when it is late only they come to the doctors. Certain diseases are all seasonal also, according to the weather. Now we get more is like stomach upset, indigestion, food poisoning, and usually we are very fond of having chutney, spicy food, fried things. So gastritis is also very common. The most current trend of diseases which are prevalent is indigestion. That is we call it gastritis. Tobacco has to be stopped. Now we have the government of Health and Family Welfare is already that around the campuses of the hospital campuses or premises of the hospitals, tobacco-free zone again. But the way we go anywhere in Nagaland, whether it's here in the city or anywhere in the village also, the way we spit, the way we throw our sputum, the way we throw the dust is increasing day by day because we are less care about the environment, which the environment has got a serious impact on our health again. You're eating, you suffer, but at the same time you throw again all the packages, surplus packages. See, earlier we have few patients, which are when I joined first in the government service, Health and Family Welfare, we hardly have maybe we are unable to reach out to all the people, but we don't have much of a cancer patient. Now you name it anyone, where this fellow, he is now under treatment, he is on chemotherapy, he is on radiation, he has taken surgery. These are all because of life-related, lifestyle-related. So I want to make it again, even our lifestyle, whatever, if I don't mention, especially this tobacco, I want to create a very strong message and request all the public as a brothers and sisters, and that we should avoid totally tobacco. I joined in 1988, government service. I never heard about it. Substance abuse or drug addictions, but of late, it has become one of the major problems. Though people don't declare openly in the society because of maybe some stigma in the family. If your brother sister is addicted to, or maybe substance user, they don't want to disclose. But this is a very pressing problem right now, and I want to advise that we should not try to taste anything, because it all starts with curiosity. If one friend is already there, you try it, it is good. Then without thinking, you try again. Out of a blue, you started, and then you can't stop again the habit. These are treatable but not curable. Another fun is alcohol, tobacco, and then eating habits. All these things, if you can minimize again. Well, I find this really very interesting. Personally, my experience. It's not a big number, but whoever come to us, to me particularly after post-COVID, I think there's a perception of the health is not up to the standard. I mean, it's that the people are sleeping more, it seems, after post-COVID. I find like that. Because maybe now the recent trend is that people sleep very late, they work late. Some people tend to sleep work at night time, like people up to 1, 2. But actually, the best timing is you sleep at 8:30 and get up at 4:30 in the morning. And what I've seen is that once your circadian rhythm, that is the clock of your natural, which is in the body, is changed again. Because why I'm stressing on this post-COVID is that we were just put self-isolation. Self-isolation, that means we don't contact with friends, we don't contact with the relative, we don't contact with anybody, and that gives you a total isolation. And now the quality of life, I should say, the quality of life has a little bit of not very much affected, but they become social friendly is not there. Personally, if you keep isolating yourself for a long period of time, you can start having anxiety, you can have panic attack, and you can lead to depression again. And once you go into depression, it is a very long term. You need to have medication, you need to consult with the psychiatrists. So what I want to advise you is that people have to move around, be social, and build outwardly. You have to come up again in the present day. You cannot keep isolated yourself. And see, just talking with friends, that doesn't do alone. Say, we have got handset, smartphone at hand. You keep on looking again. You see that people hardly see each other's face, but they are more busy with their handsets. So I think we need to have more outward social activities. I should say that even going to the church as a Christian, I think going to the church is really help a lot. Most of your problems, anxiety, depression, even having some personal addiction problem, if you follow your habit in the positive way, where people are going, the same ritual if you apply, you can come out and lead a positive and healthy life. ते अपने काम पे कल बोल सुन चावल नहीं करते तो ते बुखार लंबा सांस 1 2 3 करते हो 1 2 3 1 2 3 right side de बुलाशी ना left side de ini kasih dia tu
coughing dawa to I mean bishi stop bishi
tahu itu kasih na
boy
isim dia tu jangan benda kiko sih
itu juga guna kaya result na something negative tu ase jadi tahu itu ek minggu khabar dia lagi tu guna tahu itu ek minggu khase khabar dia ase.
With due respect to all my esteemed colleagues and friends who have already retired and led me the age of, I'm crossing the age of 60, approaching 70, I advise you that don't sit at home. Don't sit at home. You do, but I think your profession is the basic what you have learned. That your skill, you are made for that. And don't give up so easily in life. It is a full of struggle. But at the same time, you get a joy when the patient gets all right. Just I visited this morning one patient. He came to me on the first day as a only gastric problem. I have only gastric. He's self-diagnosed that he's having gastric problem. I said that he might be having gastric also, but here we have a facility you can do one simple ultrasound. When we did it, when they did the ultrasound, it was the multiple stone in the gallbladder. So on Sunday, last Sunday also I visited him at home. He's a very good, his son is a professor in science college. So I visited again. He was having a very severe pain, but I didn't tell him again because he had never been to the hospital once also in his lifetime. So when I visited him again, he was having pain, but he was very positive. I'm all right. But I also didn't say that you are having this and that. Yes, there is a stone is there and inflammation is there. This need to be taken care of it as early as possible. So I referred to one of my friend, junior friend, surgical specialist in private hospital. And immediately on the same day, he did the operation and they have shown that there's a multiple stone in the gallbladder. So he's quite happy and I'm also quite happy. Hey.